Tonight, we're going to talk about COVID-19 and the COVID-19 vaccine for children. We're here to provide you with facts about the vaccine, its safety, and answer your questions. And we will be sharing information with an open heart and with respect for our patients and the communities we serve, and we ask you to do the same. We have two extraordinary people on our panel this evening, Dr. Tracy Brooks and Dr. Luann Bruno-Murtha. Dr. Brooks is CHA's acting chief of pediatrics, and she's adored by her patients. I'm sure you'll understand why after this evening. She's continually named as one of Boston Magazine's top docs and was featured in the magazine a couple of years ago. Dr. Luann Bruno-Murtha is CHA's Chief of Infectious Disease. Dr. Bruno-Murtha has led us through this pandemic with a calm and devoted presence. And in addition to her many recognitions, she was honored last year with the Cambridge YWCA's Tribute to Outstanding Women Award. We're going to begin this event with presentations by Dr. Bruno-Murtha and Dr. Brooks. Excuse me for a second. There we go. That's going to be followed with a question and answer period. And please add your questions using the chat function. I'm going to turn this over to Dr. Bruno-Murtha to begin.
Thank you, Lexi. And I want to welcome all of you for joining us tonight. I'm thrilled that you're here, and I am going to keep my comments hopefully to under 15 minutes because we want to keep the majority of this hour open for your questions and our frank responses. So my goal in the next 15 minutes is to discuss new information that's really come out in the past couple of months about the safety and the effectiveness of the COVID-19 vaccines. And I'm really going to just be concentrating on the efficacy and safety pertaining to children, because this is the children and adolescent group are the groups that were approved for the vaccine or authorized to receive the vaccine most recently, and we haven't had as much time to vaccinate this population. So I really want to focus in on our children. I want to share updates on the vaccine effectiveness in adolescents. And when I refer to adolescents, I'm referring to the ages 12 through 17 years. And very recent published data on the efficacy of the vaccines in reducing COVID infection. And perhaps most importantly, what really is meaningful is in preventing hospitalizations, critical illness, and death. And then a very recent publication on preventing a very dreaded complication of COVID in children, referred to as multisystem inflammatory syndrome, or MIS-C. This is a dreaded complication. It's a post-infectious inflammatory condition that can literally affect any organ system of the body. And it can affect the heart, the lungs, the skin, the GI tract. And it really is a dreaded complication, and we do not want to see this occur in any of our children. And then lastly, I want to update you on the very recent eligibility criteria for adolescents and children, since some of these recommendations are very new and you may not be familiar with them. So it's just some general comments about children and COVID. In general, COVID disease is much milder in children, although severe disease and long-term complications sadly can occur. And according to the American Academy of Pediatrics, we have had in this country over 8.5 million cases of COVID to date and almost 750 deaths. And that is unfortunate. We do need to collect more data on the impact of COVID in terms of the different variants. We know that during Delta, particularly in September, there was a marked increase in hospitalizations for children due to COVID. And we will learn with Omicron the impact of hospitalizations, but we feel that that is less likely, but we're early in this process and we're still learning. We know that there have been some long-term physical complications in infected children, referred to as long COVID, where they continue to have ongoing symptoms, inability to concentrate, and some cognitive disorders, and that clearly requires further study. And we all know, we've experienced this over the past 2 years, the profound impact this pandemic has had on our children's mental and emotional health. And that is going to take us a while to recover from. But if we need to do everything we possibly can to normalize our kids' lives and to get them back in school where they could stay in school, get them back into their social activities and into their sports programs. So this was a very recent study that was published in the New England Journal of Medicine. It just came out, and it described the clinical trial for the COVID vaccine in children 5 through 11 years old. And the bottom line is this vaccine was very effective, more than 90% effective at preventing symptomatic COVID disease in children. And equally, and perhaps more important to parents, is the efficacy that this study demonstrated. It was very safe. This next slide demonstrates side effects. And if we concentrate in on this upper panel here, those are the local side effects that children who receive the vaccine or receive the placebo. The placebo is basically sterile salt that children are injected with. And for local side effects, after the first dose, on the left side of this upper panel, we see that local side effects, specifically pain at the injection site, was common in almost 3/4 of the children who received the first dose. But notice that even in children who receive a placebo shot, they have pain at the injection site. Overall, the green demonstrates that most of these symptoms were very mild. The blue demonstrates moderate. None were severe. Following the second dose, there was about the same amount of pain at the injection site in the children who received the placebo. Other reported side effects that occurred included redness and swelling at the injection site, but these were very low. On the bottom part of this slide, these are the systemic side effects that the children experienced. After the first dose, the most commonly reported side effects were fatigue. This is the vaccine group, and this is the placebo group. And really, there's no difference here in terms of fatigue after the first dose. After the second dose, there was a little bit more fatigue, notably in the vaccine recipients. And then the second most common reported systemic event in our vaccinated patients was headache. But again, headache was not that uncommon. And in fact, there was no difference after the first dose in the patients who received the vaccine versus the placebo. After the second dose, there was a little bit more headache noted in the vaccine recipients. Other side effects like fever and chills were very uncommon. And I want to emphasize there were no reported cases of myocarditis, that's heart inflammation, that we have seen in some adolescent males predominantly in the adolescent vaccine trials. But in this clinical trial, in the younger population, there was no reports of myocarditis, pericarditis, or anaphylaxis. Anaphylaxis is a serious allergic reaction. Now I'm going to share with you a lot more information about the safety of the vaccine in children. And this is data that was reported the last day of December in 2021, looking at 2 safety monitoring systems. One's referred to as the Vaccine Adverse Event Reporting System, or VAERS, and the other system is the vSafe system. That is the cell phone-based system where parents could provide feedback to CDC and FDA on their children's experience after the vaccine. They get pinged daily for the first 7 days if they agree to participate in this program. And then they are pinged less often over the course of the next several weeks, and then quarterly over the course of the first year to identify any type of unanticipated adverse reaction. And looking at both monitoring systems, both the VAERS and the vSafe app, after over 8.5 million vaccine doses in our children, they demonstrated that the side effects were mild. There were a few cases in this 8.5 million population of myocarditis, but all children had recovered or were in the process of recovering. And pain, as we discussed in the clinical trial, fatigue, and headache were the most common reported side effects, and they were mild and brief. So what should you expect if your child is vaccinated with the COVID vaccine? And there's only one vaccine authorized for children right now. It's the Pfizer BioNTech vaccine. You should expect that 1 out of 20 children will be unable to perform their normal activities on the day after they receive their first dose. So they may not feel up to going to school or participating in their normal activities. These side effects are short-lived, and after a day, most kids are back to normal. After the second dose, you should expect a little bit more in the way of a child not feeling up to par. 1 out of 14 children will experience some interruption in their daily activities after dose 2. Local and systemic side effects after the vaccine are more common after the second dose, but as I demonstrated in the clinical trial, are mild and generally short-lived. Now let's turn our attention to our adolescents, our kids that are between 12 and 17. This was another publication from that was in the Morbidity and Mortality Weekly Report, published the last day of December of 2021. And it demonstrated in adolescents, the Pfizer vaccine was 92% effective at preventing infection. That's remarkable. And that builds on a prior study that is summarized on the right of this slide, looking at adolescents, that demonstrated a 93% reduction in hospitalizations among vaccinated adolescents. And among hospitalized adolescents, it reported that 97% were unvaccinated, and no vaccinated adolescents that were hospitalized required intensive care unit admission. Another report, the first week of January, out of Morbidity and Mortality, looked at the ability of the vaccines to prevent multisystem inflammatory syndrome, or MISC, the dreaded complication that I discussed earlier. And it demonstrated that the Pfizer vaccine was 91% effective at reducing the risk for this dreaded complication. And when they looked at patients that were hospitalized with MIS-C, 95% were unvaccinated. And no vaccinated patients that developed MIS-C, the very small number, required life support. And then even a more recent publication in the New England Journal of Medicine, looking at the effectiveness of the Pfizer vaccine against critical illness in adolescents. And it demonstrated 94% effectiveness at preventing hospitalization, 98% effectiveness at preventing intensive care unit admission and life support, and 100% effective at preventing death. All 7 deaths that occurred in this report were in unvaccinated adolescents. So what are some updates that I'd like to share with you regarding adolescent vaccination? We know now that boosters are very effective at helping to broaden our immune response and strengthen protection against the Omicron variant. So it's very important for our adolescents to get vaccinated and then to be boosted. And CDC just recently expanded eligibility for our adolescents 12 through 15. 17 and 16 through 18 were already authorized to be boosted, but now it includes 12 through 15-year-old adolescents. And this was based on a very careful review of safety data after 25 million doses had been administered to this age group. And they concluded that vaccines are safe and effective, and in order to provide added benefit against variants, they are now recommending that our adolescent children get boosted. Another report that was recently published, this is probably the most recent publication, looking at the association of newly diagnosed diabetes mellitus more than 1 month after COVID infection among children. And this looked at 2 large commercial health systems and looked at claims, and it identified that children that had a COVID infection were more than 2.5 times more likely to be diagnosed with diabetes. That is really unfortunate because diabetes is a lifelong diagnosis that requires lifelong treatment and unfortunately is associated with a lot of complications. So vaccination is a way to prevent yet another dreaded complication of COVID in our children and clearly highlights the importance of vaccination. So where are we at Cambridge Health Alliance? We have an opportunity to do better, although we are doing reasonably well. Among our adolescent patients that we care for at CHA, 42% have been fully vaccinated, meaning they've received 2 Pfizer doses, and an additional 5% have been boosted. So we are above the national average for our adolescent population. For our younger children, age 5 through 11, we have fully vaccinated, about a quarter of our population. So we have an opportunity to do better there. And I hope that for some of you who have questions around your children, and if you're on the fence, we will get to those and address those later on. So my recommendations for our children and next best steps is to vaccinate all our kids that are 5 through 17 years of age and to boost our adolescents 5 months after they completed their primary series. So this is another recent change. Previously, boosting followed 6 months after the second dose. It has now been reduced to 5 months. And CDC also recommends a third dose for certain immunocompromised children who are in the 5 through 11 age group. So with that, I hope I provided to each of you some more information to convince you that these vaccines are safe and are effective. And I know that my colleague Tracy Brooks and I look forward to taking your questions. Thank you for your attention.
Thank you so much, Luann. Dr. Bruno Murtha, that was wonderful. We're going to turn it over to Dr. Brooks, who I think is going to share some insight about what's happening with her patients, and COVID, and then we'll open it up for questions. And feel free, people who are here, if you want to start adding your questions now, that would be fine.
Thank you. Thank you, Dr. Bruno Murtha, for that wonderful presentation. And thank you, Lexi, for that introduction. I talk with patients and their parents about COVID every day, every single day, because people come in with all kinds of questions and concerns. And I think part of it is having access to so much information on the internet, where you can pretty much find anything to be able to tell you anything, has a lot of people very worried because they are experiencing quite a bit of misinformation that they see on the internet about the vaccine and its safety and effectiveness for the younger children. One thing that I'm very hopeful for right now, we're able to vaccinate kids that are 5 and up. I'm hopeful that those numbers will actually continue to decrease in terms of the ages of patients that we're able to vaccinate. I'm not sure when we will have vaccinations available for children in the younger age groups, but that I think is part of the reason that it's very important to vaccinate the 5 to 11 so that they're not going to school and then bringing the infection home to their younger siblings who are unable to be vaccinated. The biggest, I think I spend quite a bit of time just offsetting various myths about the vaccine because there certainly are quite a few myths out there. And I would say one of the number one myths that I discuss with families is uh, when they come in and say, "Isn't it better for my child to just naturally get COVID rather than getting the vaccine?" And the answer to that is no. As we already saw from Dr. Bruno Murtha's presentation, there's some significant complications that can come from getting natural COVID, and not the least of which is the MIS-C, which has now been found in over 8,000 kids in the US, but also that increased risk of diabetes. And when you had the slide up, I did remember that actually one of my colleagues from fellowship was one of the folks who participated and authored that study. So that was a good reminder for me. But it does seem to be that there's about a 2.5 times risk of children developing type 1 diabetes following natural COVID uh, acquisition. The other concern is I've actually now started to see some families who have had COVID more than one time. And so the question is what long-term effects might be associated with having different strains of COVID over time. And that's something that we're not we need to continue to follow and continue to evaluate. But I do think that that is something that is concerning. Getting back to routine, getting back to normal activities, I think is everybody's big priority. And especially for school-aged children and adolescents, being able to be back in school with their friends has been the number one. Every time I have patients come in and we're talking about how they're doing as part of their well child check, I ask them if they prefer remote school or in-person school. And hands down, with very, very few exceptions, I think all of the children have said that they definitely prefer in-person school. They like to be able to see their friends. They want to be able to get back to their usual activities. They don't want to be sitting at home on the computer during the day to be able to learn. And in fact, many recognize that they don't learn nearly as well that way. And that appears to be the case for so many teenagers. So helping folks be able to get back to usual school routines, even though we are continuing to test in school, the numbers are the numbers of positive infections right now are still surging just because we don't have all of our school attending children being vaccinated. Another myth that comes up not infrequently is that parents are concerned about the possibility of any future fertility issues for their children. I've also heard some complaints of changes in menstrual cycles and concerns about possibly alternating or altering the DNA of patients just by them getting the vaccine. And there's no evidence for any of this to be the case. With, again, the multiple billions of vaccine. If you think about across the world, how many people have actually been vaccinated, there does not seem to be amongst either adults or adolescents any fertility concerns or worries about that. The changes in menstrual pattern appear to be mostly anecdotal. That means that they're just reported stories that people notice that they've had changes in their menstrual patterns, but there's no study that has been done that has demonstrated that that is a long-term effect or a long-term concern. I just want to continue to emphasize the decreased risk of hospitalization as a result of getting the vaccine. The fact that it is 94% decreased in both the 5 to 11 age group as well as the 12 to 17-year-old age group, and certainly 100% decrease in death secondary to natural COVID, I think is a very, very big incentive for having children be vaccinated, both with the primary series of 2, as well as getting boosted if they are able when the time comes, that 5 months out. It's that people come in with are, if children aren't that severely harmed by COVID, if they're not really getting all that sick from getting natural COVID, why bother? And as we keep emphasizing, to prevent these long-term outcomes, but also to protect others who may not be able to be vaccinated or who may not get enough as much immunity secondary to immunosuppression issues, protecting younger age siblings at home, protecting older grandparents, um, who also may be living in the home or helping to care for the children, as well as protecting teachers and staff at school and other people who potentially could be impacted by a COVID outbreak. That, and with everyone getting vaccinated, this is how we get out of the COVID outbreaks. And people come in concerned that the vaccine actually might be more of a risk factor at creating different variants, and the opposite is true. Being vaccinated does not create other variants. It does not predispose people to having other types of variants. And in fact, the variants are created because the virus is being spread amongst people who are not vaccinated, and it continues to mutate and spread more efficiently, which is what we're seeing right now with the Omicron compared to previous variants. That it's much more transmissible, much more easily spread. We're seeing much more positivity, not as significant of disease, at least amongst children and younger people, but still, it's a concern that we don't want to stay in this pandemic forever. And we keep pushing back when we think that it may be over. And for the foreseeable future right now, as long as we are under vaccinated, we're not vaccinating these key age groups, it's going to be very hard to move forward from Omicron and from COVID in general.
So, Dr. Brooks, on that same line, one of the things that I remember sort of early on in the pandemic were a lot of cultural reasons not to get vaccinated. And some people were arguing that, if they took natural treatments like teas or things like that, it could protect them. Can you speak to that issue at all?
Yes, again, you can find anything on the internet that could potentially be a cure or a preventative for COVID. But really, the only things that we have, the only real tools in our toolbox that work, are masking and social distancing and vaccination. And I think that we really need to emphasize that some of these more natural remedies or unproven remedies of taking other various medications are not helpful and have not been shown in any studies to decrease the spread of COVID. I think that there is a history amongst culturally about people being skeptical of medications and of medicine and of trials and the like, because people have certain cultural groups, of course, have a history of having been treated uh, experimentally against their will or without their knowledge. And I understand that folks are reluctant to embrace something that is considered to be new. But the technology for the vaccines has actually been around for many, many years and has not been used up until now with the mRNA type vaccines in any kind of mass scale to prevent against COVID. So it's not that the technology itself is new, it's just that this virus is new. And we are now able to utilize some protection for ourselves against it. And I think that if anybody is concerned, if they're concerned, talking in forums like this or speaking directly to your primary care uh, physician or your child's pediatrician or family medicine doc is key. we won't steer you wrong. I'm a firm believer in the science. And I say to families all the time who come in very skeptical, I've been your pediatrician for a long time. In many cases, I was actually the pediatrician for the parent because I've been at CHA for that amount of time. So now some of my earlier patients are now starting to have families of their own. And so I think that that direct connection to me of having known me and having successfully cared for them for so long goes a really long way into helping people feel more comfortable about getting the vaccine for their children. Because I would never intentionally steer anybody wrong. I do think that it is it, it's just paramount for everyone to have appropriate and correct information. And that's what I want to provide. And I do during the course of visits.
That's really helpful. Thank you for that. And you also touched on what I wanted to draw out, which is the skepticism of this newness. And your answer to that is perfect, explaining a little bit about mRNA, and that it's really been around for a long time. And there have been many people who have participated in the development, which are representational of a wide variety of populations, many of whom we serve at CHA. So this question actually would probably be for Dr. Bruno Murtha. Can you tell us a little bit about whether or not the Moderna vaccine may be approved for children?
In fact, Lexi, I heard today that it will be going before the FDA for consideration. So I think that actually may happen. And I also heard within the past week that there is optimism around vaccines for 2 to 5, perhaps late spring, early summer. So that's at least something to be hopeful for. Yeah, I think it's going to be really important to really get that age population. And I know they're working as hard as they can to bring this to fruition as quickly as possible.
Great, thank you. And thank you, Jeff, for adding a question in the chat, which is, if your child has had COVID, should you get them vaccinated? And if so, how long should you wait after they've been sick?
Yeah, thanks, Jeff. This is a great question. I get this question a lot. And what I could tell you is that anyone who's had COVID is actually eligible to get their vaccine when they're considered no longer contagious. So for coming into healthcare, you're considered no longer contagious after 10 days of a mild to moderate illness. It's a little bit different than the new guidance for the public, but this is what we use in healthcare. Healthcare has a little different guidance. However, having said that, we also know that if you've had COVID, you are going to be protected for likely the next 3 months. So my recommendation when I get this question is I recommend that people target 8 weeks to start getting vaccinated. So that by the time that 90 days rolls around, you will have actually had both vaccines in your system, and then we'll have protection against, hopefully not a new variant, but we need to be prepared for that. So you will have robust protection at the time that 90-day point is reached, when we know that protection from natural infection is not optimal.
Now, that being said, I have used the 10-day guideline, though, in the office. We are fortunate enough to be able to offer the vaccine actually directly in our office without folks needing to go to a vaccination site. Right now, we're mostly doing well child visits, but because they're coming in and potentially are needing to get additional vaccines as well. Some parents are just like, you know what, let's just do it. We're here. I don't know when we'll be able to reschedule or to schedule an appointment to be able to come back just to get the vaccine. That seems particularly effective, honestly, when I've got like the 16, 17, 18s who really try to come into the office as little as possible. So I call it the strike while the iron is hot approach, especially after finishing the conversation and then just being able to move on and incorporate it into the other vaccines that they're getting into the office. So I have given them as soon as 10 days just to be able to get that ball rolling.
I absolutely agree with that approach. If never miss an opportunity to vaccinate anyone. And if they're in your office and they're no longer contagious, we should definitely be encouraging vaccination. We shouldn't delay, but I strongly encourage that we don't go beyond 8 weeks.
That's great. Thank you for those clarifications. So there is a question now in the chat from Sarah, and she's asking about, are these vaccines for children fully approved, or are they still under the emergency approvals, which I think is something that's actually really a good thing to discuss. And maybe Luann, Dr. Bruno Murtha, you could get us started with that, and Tracy, Dr. Brooks, if you have anything to add.
Yeah, so for the 16, 17 ages, it is fully approved. The FDA has fully approved the Pfizer BioNTech vaccine for that age group. For our younger adolescents and our 5 through 11, the vaccine is authorized. And the reason that is because the FDA requires many months of follow-up data before a vaccine will be eligible for full approval. And it's going to take probably 6 to 12 months for these to be fully approved for adolescents 12 through 15, and then probably a little bit longer because, as you know, the 5 through 11 was just authorized, I believe it was in October. So we need at least 6 months of safety data before the company can even submit to the FDA for full approval.
And how many pediatric patients do you know have been, I think you said, was it something like 8.5 million or?
Yes, over 8.5 million have been vaccinated now.
Right. So there's quite a large number to demonstrate, I think, at least on the short term, how safe it is and how effective it is.
Right. So, we're only a couple months into this, so that's why they can't submit yet for full approval.
That's great. So, Dr. Brooks, if people are not able to come in to get vaccinated, where are you telling people to go to get vaccinated? And I can help with this as well, with talking about our vaccination center and other sites.
I was just going to say, to our vaccination center, which we do have at CHA. However, I've had patients also getting appointments at pharmacies, and having that be reasonably successful, although the booking time right now is a little bit farther out for folks. But CHA has a very robust vaccination center that people have been going to throughout the pandemic to be able to get their children vaccinated. I know not all pediatric offices are offering the vaccine within the office. So finding out, and I'm sure Lexi will be telling us what the options are within CHA to be able to get children vaccinated are. But basically, I say get the vaccine wherever you can get the vaccine. Is the short answer. So if that is a Walgreens, if that is CVS, if it's in your pediatrician's office, if it's at a larger vaccination center, if it's at a mass vaccination program such as the ones that they're having at Fenway Park and that they have had in the past at Gillette, those are also options as well.
Great. And I did want to tell people that our vaccination center is having a Saturday, a series of Saturday, they're going to be open on Saturdays. Usually we're open during the week, but we want to be able to offer vaccinations to people who can't make it during the week. who need some off hours or times to access it. And we do have space this weekend, this Saturday, for people to be able to come. And you can get all kinds of information on our website. And I'm going to put in the chat a link, which gives you all kinds of information about where you can get vaccinated and information about hours and everything. And that is a great place to go because sometimes things change in terms of hours and availability. So it's always a good idea just to check our website to see what's happening.
Lexi, are family members, say, of people who may not be CHA patients able to come to the CHA vaccine site to get vaccinated?
They are. And we are now taking walk-ins. So, we encourage people to make appointments when you can, and you can do that on the state website. But if you can't, come walk in. At this point, we have space for people, so people can come, and it's open to anybody.
One comment that I'll make is I have a lot of patients who are very needle phobic. They absolutely positively do not want to get vaccinations. And that ranges all ages. I have plenty of patients in their 20s who are very needle phobic. But I will tell you, I have been so pleased, surprised, and impressed with my needle phobic patients who have gotten their entire COVID series as well as the booster. And I have one particular 17-year-old that comes to mind. And she came in for her physical and we were talking about vaccines and she's like, you won't believe it, but I got the COVID vaccine because I know that this is how I'm going to be able to keep myself, my family, and my friends safe. So I was able to suck it up. And she's like, actually, it wasn't so bad when I realized what I was doing it for. So don't let fear of needles be a detriment. Sometimes we can do some different things about that, especially if children are very, very worried. There are some numbing creams that you can use. I think MLOC comes to mind, which is a topical lidocaine that you can get either as a prescription or though I think some are available over the counter as well, that you can apply about 45 minutes and then cover with some sort of non-permeable wrap like saran wrap on the site where the vaccine would be given. And that at least gives some topical numbing to the skin. Which sometimes can be very helpful for folks who are very worried.
That's great. I can also say I got my booster at the vaccination center, and it didn't hurt at all. I was so impressed with the nurse who gave it to me because I was like, oh, wow, that you're done? I didn't even feel it. So sometimes that can happen too, which is always a nice surprise. This is great. So I'm not seeing any more. Oh, good. Here's one more question. Oh, Joanne Ferraro says, there's a numbing spray we've used at the City of Cambridge vaccine clinics that has had great reviews from the children who received it. So that's great to know too. Thank you for sharing that. So I'm going to give folks just one more moment. If you have any other questions you can add in, please do so. And if not, I think what we'll do is just thank both of our panelists, Dr. Bruno Murtha and Dr. Brooks, for giving us their time and sharing their expertise and their stories. And we're just so grateful for all of the work that you're doing. And we are very appreciative of not only all you do, but what CHA is doing for the community. And we thank folks for joining us tonight. And we will look forward to staying in touch in the future. And we're getting lots of thank yous in the chat at this point. So reinforcing that message. So thank you, everyone.
Thank you so much.
It was fun.
Yes, it was a wonderful opportunity.
Good.
Stay safe, everyone.
Please, mask up.
Yes.
Get vaccinated.
Yes.
Get our kids vaccinated.
Mask up and get vaccinated.